Welcome to Healthy Insider, where we empower you with practical, natural health insights. Today, we're diving into a topic that's often whispered about but rarely openly discussed: maintaining robust erectile function, especially as we navigate the journey past 50. If you're a man in this age group, you've likely noticed changes. Perhaps morning erections aren't as consistent, or achieving and maintaining firmness takes more effort. These experiences are incredibly common, but they don't have to be your permanent reality. Forget the notion that declining erectile health is an inevitable part of aging. While certain physiological shifts do occur, the truth is, your body's capacity for strong, healthy erections is far more resilient than you might imagine. We're going to explore a powerful, often overlooked approach, targeting specific pressure points in your body that can unlock better blood flow, nerve signaling, and overall vitality, leading to more reliable and rock-hard morning erections. This isn't about quick fixes or pharmaceutical interventions, but rather about tapping into your body's inherent wisdom and capacity for self-healing. We're talking about tangible, actionable strategies you can integrate into your daily routine, often with just a few minutes of focused attention. So, settle in, keep an open mind, and prepare to discover a path to renewed confidence and a stronger connection to your own masculine health. This journey is about empowerment, education, and embracing a holistic view of well-being. Our first critical point, the one we'll call point alpha, is located in an area crucial for circulation and nerve supply to the pelvic region. This point, often referred to in traditional practices, plays a significant role in encouraging robust blood flow. Think of it as a central hub where energetic pathways converge, directly influencing the arteries that feed the penis. As we age, these pathways can become sluggish. Blood vessels can lose some of their elasticity, and the delicate balance required for an erection can be disrupted. Applying targeted pressure here can act like a gentle internal massage, coaxing those vessels to dilate and allowing blood to flow more freely. Imagine a garden hose that's slightly kinked. A little pressure in the right spot can straighten it out, allowing water to gush through. Similarly, stimulating point alpha helps to remove subtle obstructions and encourages optimal vascular function. It's not just about blood flow, though. Nerve signals are equally vital. Erections are a complex interplay of vascular and neurological responses. The brain sends signals down the spine, triggering a cascade of events that ultimately lead to engorgement. When these nerve signals are strong and unimpeded, the response is quicker and more complete. Point alpha also helps to invigorate these neural pathways, ensuring that the messages from your brain arrive loud and clear. This is particularly important because, for many men over 50, a decrease in nerve sensitivity or efficiency can contribute to erectile difficulties. By stimulating this area, you're essentially tuning up your internal communication system, making it more responsive. Locating point alpha requires a bit of anatomical awareness, but it's straightforward once you know where to look. Imagine a line running straight up from the center of your perineum, that area between the anus and the scrotum. Now, move approximately 1 to 2 inches forward along this line, towards the base of the penis. This general vicinity is point alpha. It's often found in a slightly softer, more yielding area, not directly on bone or hard tissue. To apply pressure effectively, you'll want to use your thumb or the tip of your index finger. Begin with gentle, circular motions, gradually increasing the pressure to a comfortable depth. You shouldn't experience sharp pain, but rather a sensation of deep pressure or a dull ache. This is a good sign that you're engaging the right area. Hold this pressure for about 30 seconds to a minute, breathing deeply and consciously. You can repeat this process 2 to 3 times. The ideal time to do this is in the morning, perhaps while still in bed or as part of your evening routine. Consistency is key here. Think of it as training. Just like strengthening any other muscle, regular stimulation yields the best results over time. You might not notice dramatic changes overnight, but with consistent application, you'll likely observe a gradual improvement in the frequency and firmness of your morning erections. This practice also serves as a mindful connection to your body, bringing awareness to a part of your physiology that directly impacts your masculine vitality. Moving on to our second crucial point, point beta. We shift our focus slightly, but its impact is just as profound. Point beta is situated on the inner thigh, a region often associated with key energetic meridians in traditional Chinese medicine, and home to significant vascular and nerve bundles. Specifically, we're looking for a spot about 4 finger widths above the inner ankle bone, on the backside of the shin bone, closer to the calf muscle. This point is known for its ability to regulate kidney energy and influence the liver meridian, both of which are deeply connected to reproductive health and overall vitality in holistic practices. From a Western anatomical perspective, stimulating this area can help improve peripheral circulation, encouraging blood flow not just to the immediate area, but subtly throughout the lower extremities and pelvis. The arteries supplying the penis branch off from larger arteries in the pelvis and legs, so promoting healthy circulation in this broader region has a direct positive effect. Imagine a network of interconnected rivers. Improving the flow in one major tributary can enhance the flow throughout the entire system. Point beta helps to optimize this systemic circulation, ensuring that the blood supply to your most intimate parts is unhindered and robust. Beyond circulation, point beta is also believed to play a role in calming the nervous system and supporting hormonal balance. Chronic stress, anxiety, and an overactive sympathetic nervous system can significantly impede erectile function. When you're constantly in fight or flight mode, your body prioritizes survival functions, diverting blood away from non-essential processes like digestion and, yes, erections. By stimulating point beta, you're sending signals to your body to relax, to shift into a more parasympathetic state, the rest and digest mode where optimal bodily functions, including sexual ones, can flourish. Furthermore, hormonal balance is critical for libido and erectile strength. While not a direct hormone producer, this point is thought to support the body's endocrine system, subtly encouraging the healthy production and regulation of hormones like testosterone. While aging naturally brings some decline in testosterone, optimizing its utilization and supporting the systems that produce it can make a significant difference. Think of it as creating an optimal internal environment where all the pieces necessary for strong erections can function harmoniously. It's a holistic approach that acknowledges the interconnectedness of your physical and energetic systems. To locate and stimulate point beta, sit comfortably with your leg extended or bent at the knee, allowing you easy access to your inner ankle. Find your inner ankle bone, then measure up roughly 4 finger widths. That's about 3 inches. Move slightly behind the prominent shin bone, feeling for a tender spot in the soft tissue. You might feel a slight indentation or a point of mild sensitivity. Use your thumb or index finger to apply firm but not painful pressure. You can use a steady, sustained pressure or gentle circular motions. Aim for about 30 seconds to 1 minute on each leg, repeating 2 to 3 times. This is another point that benefits greatly from regular, consistent application. You can incorporate it into your morning routine, perhaps while having your coffee, or as a calming practice before bed. Some men find it helpful to stimulate this point while meditating or simply taking a few deep breaths, enhancing the relaxation response. The beauty of these pressure points is their accessibility and the fact that you don't need any special equipment or expertise, just your own hands and a willingness to connect with your body. With consistent practice, you'll begin to notice a difference in how your body responds, feeling more energized and responsive in all aspects, including your morning erections. Remember, every small, consistent effort compounds into significant results over time. Our third and final essential point, point gamma, takes us to an area that might seem less directly related but holds immense systemic significance for male sexual health. Point gamma is located on the sole of your foot, specifically on the ball of the foot, in the depression formed when you curl your toes. This point is often referred to as kidney 1 in traditional Chinese medicine, and it's considered one of the most vital points for grounding, energy, and overall vitality. particularly related to the kidneys, which are seen as the source of foundational energy and reproductive essence. From a Western perspective, stimulating this area, rich in nerve endings, sends powerful signals throughout the body, engaging the parasympathetic nervous system and promoting relaxation. It also helps to improve overall circulation to the extremities, which, as we discussed, contributes to healthier systemic blood flow. Think of your feet as microcosms of your entire body, densely packed with nerve receptors that, when stimulated, can have far-reaching effects. Activating point gamma helps to wake up these pathways, sending a clear message of rejuvenation and energy balance throughout your system. The connection between point gamma and erectile function, while seemingly indirect, is profound when viewed holistically. The kidneys, in traditional medicine, govern not only sexual vitality but also bone health, hair growth, and overall aging processes. A strong kidney essence is equated with robust health and a vibrant sex life. By stimulating point gamma, you're not just affecting local circulation. You're tapping into a deeper, energetic reservoir that supports all these functions. It's like tending to the roots of a tree to ensure its branches bear fruit. Furthermore, many men experiencing erectile dysfunction also report feelings of fatigue, low energy, and even anxiety or depression. Point gamma is known for its grounding effect, helping to dissipate excess mental energy and bringing a sense of calm and stability. When your mind is clear and your body feels grounded, the conditions for spontaneous, firm erections are naturally optimized. Chronic stress and mental chatter can be huge inhibitors of sexual function, and this point offers a simple yet powerful way to counteract those influences. It helps you return to a state of inner balance where your body can perform at its best. To effectively stimulate point gamma, it's best done while seated comfortably. Cross one leg over the other, bringing the sole of your foot within easy reach. Locate the depression on the ball of your foot that forms when you curl your toes. You can use your thumb or the knuckle of your index finger. Apply firm, steady pressure to this point. Again, it shouldn't be painful, but you should feel a distinct sensation of pressure or a pleasant ache. You can hold the pressure for 1 to 2 minutes, breathing deeply throughout, or perform small, circular massage movements. Repeat this on both feet. This is an excellent point to stimulate at the end of a long day, as it helps to release tension and ground your energy. It can also be incorporated into your morning routine to kickstart your day with a sense of calm focus. You might even consider investing in a small foot massager or a textured ball to roll under your foot, allowing for sustained pressure and broader stimulation of this vital area. Consistency, as with the other points, is paramount. By regularly engaging point gamma, you're not just addressing erectile health, you're investing in your overall vitality, resilience, and sense of well-being, which inevitably spills over into a more robust and fulfilling sex life. Beyond these 3 powerful pressure points, it's crucial to understand that they are part of a larger ecosystem of health that influences your erectile function. While stimulating these points can provide significant benefits, they work best when supported by a foundation of healthy lifestyle choices. This includes maintaining a balanced diet rich in whole foods, managing stress effectively, ensuring adequate sleep, and engaging in regular physical activity. For instance, a diet rich in antioxidants, healthy fats, and nitrates, found in leafy greens and beets, directly supports vascular health, making your arteries more supple and responsive to blood flow. Similarly, stress reduction techniques like meditation, deep breathing, or spending time in nature can calm the nervous system, allowing your body to shift out of that fight-or-flight mode and into a state conducive to sexual arousal. Sleep is another often underestimated pillar of erectile health. During deep sleep, your body repairs itself, balances hormones, and rejuvenates its systems. Chronic sleep deprivation can significantly impact testosterone levels and overall energy, directly affecting your libido and ability to achieve erections. Regular exercise, especially a combination of cardiovascular activity and strength training, also plays a pivotal role. Cardio improves heart health and circulation, ensuring efficient blood flow throughout your body, including to the penis. Strength training, particularly compound movements that engage large muscle groups, can naturally boost testosterone production. Pelvic floor exercises, often known as Kegel exercises, are also incredibly beneficial, strengthening the muscles that support erections and ejaculation. These complementary practices enhance the effects of pressure point stimulation, creating a synergistic approach to improving your erectile health. Think of the pressure points as accelerators for a well-maintained engine. If the engine itself is neglected, even the best accelerators will have limited impact. By integrating these holistic elements, you're not just seeking a temporary solution, but fostering long-term sexual vitality and overall well-being. This comprehensive approach empowers you to take charge of your health, not just for the sake of erections, but for a richer, more vibrant life as a man over 50. It's also important to remember the psychological component of erectile function. Anxiety, performance pressure, and negative self-talk can be significant barriers. Many men experience a vicious cycle where early difficulties lead to anxiety, which in turn makes subsequent erections even harder to achieve. Breaking this cycle often involves a shift in mindset and a focus on self-compassion. The practices we've discussed today, including the pressure point stimulation and mindful breathing, can serve as powerful tools to reduce anxiety and reconnect you with your body in a positive way. They offer a sense of control and agency, reminding you that you have the power to influence your own health. Visualizations and positive affirmations can also be incredibly helpful. Imagine yourself with strong, firm erections, feeling confident and desirable. Our minds are incredibly powerful, and by consciously directing our thoughts and beliefs, we can create a more supportive internal environment for sexual health. Sometimes, simply knowing that you are actively working on improving your situation, rather than passively accepting decline, can alleviate a huge amount of mental burden. For men over 50, open communication with a partner, if applicable, can also be a game changer. Sharing your experiences and concerns can reduce feelings of isolation and pressure. A supportive partner can be an invaluable ally on this journey, fostering an environment of understanding and intimacy. If you're experiencing significant or persistent issues, consulting with a healthcare professional is always advisable. They can rule out underlying medical conditions, such as heart disease, diabetes, or hormonal imbalances, which can contribute to erectile dysfunction. These pressure point techniques are intended as complementary practices, not replacements for medical advice or treatment when necessary. However, for many men, especially those whose issues are multifactorial and related to age-associated changes, lifestyle, and subtle energetic imbalances, these natural approaches can provide profound benefits. They offer a gentle, empowering path to reclaim your vitality and sexual confidence, reminding you that age is just a number, and a fulfilling, active sex life can certainly continue well past 50. In summary, we've explored 3 crucial pressure points. Point alpha, near the perineum, for direct blood flow and nerve stimulation. Point beta, on the inner shin, for systemic circulation and nervous system calming. And point gamma, on the sole of the foot, for grounding, overall vitality, and kidney energy. By consistently applying pressure to these points, you are actively engaging your body's natural healing mechanisms, encouraging robust blood flow, optimizing nerve signaling, and fostering a balanced internal environment conducive to strong, healthy morning erections. This is not about magic, but about recognizing the intricate wisdom of your own body and giving it the subtle nudges it needs to perform at its best. Combine these targeted techniques with foundational healthy habits, a nutritious diet, stress management, quality sleep, and regular exercise, and you create a powerful, holistic strategy for lasting male vitality. Remember, the journey to renewed erectile health is a marathon, not a sprint. Be patient with yourself, celebrate small victories, and embrace the power of consistent, mindful self-care. Your body is an incredible instrument, capable of remarkable healing and rejuvenation. It's time to unlock that potential and reclaim the confidence and joy that comes with a vibrant, active sex life, regardless of your age. Thank you for joining us on Healthy Insider, where we believe in empowering you to live your healthiest, most fulfilling life.